Good evening. I'm Ed Volpin-Testa, a primary care doctor here in Bethel, and welcome to another edition of Ideas at Work and Beyond. I want to remind you that this is a live call-in show. The number is 792-4101, 792-4101. And just want to remind you again that in the fall I'm planning to have my own show, Dr. V on Call, so we'll hope to be seeing you then. Tonight I have a good friend and a great doctor, Dr. Bill Delaney. Bill is a general internist, and he is the executive director of the Community Health Center in Danbury. We're going to be asking Bill to explain to us what's going on, what he does, and the types of patients that he sees. Our focus tonight is on providing insurance to the uninsured. And I have another guest, Dr. Mike Towie, and Mike is a little bit late, and we're getting him set up to come aboard right now. We're just putting a microphone on Mike, and he's going to be with us too. And Mike runs, also delivers a lot of care to the uninsured in Newtown, Kevin's Clinic. Mike, welcome. And Mike also is a general internist, a good friend of mine, and I've known him for a long time too. So the focus tonight, fellas, is providing care to the uninsured and the indigent. And it's a live call-in show, so we'll get some questions from the audience. 792-4101. Bill, let's start with you. Just tell us, and I always say to the audience, just pretend that we're there in your living rooms. We're sitting down having a cup of coffee or a beer. This isn't a college course. This is just something nice and simple for your education. Bill, tell us, what is it that you do there at the Community Health Center? How'd you get started? What's going on over there?
All right. Well, the Seaford and Ford Community Health Center is a Danbury hospital facility, and I've been there for a little over 2 years. And the focus is on the care of the Medicaid population in Danbury, and also for a significant part of our population is uninsured. We have 4 parts to our center. There's an adult section, a geriatric section, a pediatric section, and a dental area.
I didn't know you did dental too.
Yes, it's a large building with lots of activity, and over 40,000 visits a year to the facility.
That's significant. 40,000 a year. That's a lot.
Yes.
When you think that the emergency room is, I'm trying to think. We had Pat Broderick on one night, and I don't want to repeat these numbers, but I'll probably get them wrong. Something like maybe 75,000. Is that on the low side?
Yeah, they're running 24 hours, 7 days a week, so I don't know their numbers, but I'm sure they're at least at that.
So that's quite a bit.
They're one of the busiest emergency rooms in the state.
Right. We're going to get back to you, Bill.
Yeah.
Mike, tell us what you're basically with Kevin's Clinic.
Yes.
What's that all about?
Kevin's Clinic is a free clinic, 501c3, non-profit, of course. Started 5 years ago. We see primarily uninsured patients and underinsured. It is a free clinic, so we don't charge for any of the services we provide. We see patients on Wednesdays, typically from 1 to 5 o'clock.
1 to 5 on Wednesdays.
1 to 5 on Wednesdays. We started at Fairfield Hills in Newtown. We moved to Peck's Lane. That's where we are at this time. We're moving back to Fairfield Hills probably soon. And we're looking to expand the operations to twice weekly. As the volume continues to increase, of course, this becomes a necessity. And we are seeing patients not only from Newtown, but also from surrounding towns.
It's amazing.
More and more, greater population, more and more people uninsured or underinsured.
Mike, how do patients get in touch with you? Is it just Kevin's Clinic in the phone book?
We have a website, kevinscommunitycenter.org.
kevinscommunitycenter.org.
And we have our phone number is area code 203-426-0496.
426, say it again.
0496.
0496.
And the nurse picks up the messages 24/7, 7 days a week. Of course, we're only there on Wednesdays to see patients. But we have a lot of other activities going on different days of the week. and we retrieve messages and respond daily, on a daily basis.
That's great. Well, for those of you who just tuned in, we have two physicians here, Dr. Mike Tolwe and Bill Delaney, both of whom spend an awful lot of time delivering care to the uninsured. That's the whole focus of tonight's program. Call in with any questions. Bill, let me just ask you something. What's the spread of the patients that you see? I mean, all ages, adults?
Well, personally, I see adults. The facility does have a pediatric center, so we run all ages. In fact, today I saw a woman 100 years old. But you know, they see the pediatrics sees the newborns, and so we see all age groups in the facility.
So you're as the director. So you have a whole. I didn't know that you had a whole team there to explain that.
Well, I mean the pediatric department has 2 full-time pediatricians and a nurse practitioner. The adult and geriatric section, we have 3 attending physicians and a nurse practitioner. But in addition to the primary care services in our building is a host of subspecialty care geared to care for the uninsured and the poor of Danbury. For example, orthopedic clinic is there, podiatry clinic, and a whole host of other clinics are there running simultaneously to our primary care operation.
See, that's a great point about this show, Bill. Now, here I am. I'm a physician here for over 30 years in town. I didn't know that you had such a big operation there. Now, I don't think many people knew that either. So altogether, how many are you?
Well, I don't, let's see, the dentist, there's only one chief dental officer, and he has a host of community dentists that come in. But then there would be 5 attendings and 2 nurse practitioners, but there's a whole host of subspecialists that come in and just do, like Kevin's Community Center runs a half-a-day a week.
Right.
A lot of those clinics are half a day a week also.
Right. And how do you, is it a problem, referrals for specialty care? Somebody comes in and they have an orthopedic problem that perhaps maybe you don't feel comfortable in dealing with. Getting an orthopedist or a cardiologist, how's that work, Bill?
Well, it is a challenge, and I think the audience should be aware that it's a huge task for the people who are uninsured or poorly insured to get that type of care that some people take for granted when they have insurance. It may take, to get an orthopedic clinic appointment, it can take more than a couple of months to get in. And if I'm faced with the situation that needs more rapid response, I have to basically get on the phone and try to set up a special...
So that's a big challenge for you.
It's a big challenge.
To our audience, I see there's a caller, and I'm going to take this call now, and here we go. Caller, go ahead. No? Okay. You there? Nobody. Okay. Hello? Okay, well... Maybe somebody got shy and hung up. No, okay. And Mike, how about yourself? What kind of, when you're taking care of all these uninsured, how do you get funded? I mean, where's that all come from?
Our funding is primarily individuals and community organizations, and that's how we get our funding. We face many of the challenges that Bill just mentioned. We have been fortunate, however, we do have a network of referrals of physicians, specialists that take on our patients pro bono. They don't bill for their services, they see our patients free of charge. So if we have a patient that needs to see an orthopedist or a neurologist, an optometrist, pulmonologist, we're able to refer them out pro bono, no charge, for Kevin's or for the patients.
That's wonderful. And I'm glad, Mike, you're saying that, because sometimes the audience feels that maybe the medical profession isn't doing enough for the indigent. And it's nice for them to hear that that when these people come in, they don't have any insurance, and you can refer them out, and there are doctors in the community who will provide this service.
In fact, there's a lot of doctors who are more than eager to do it. Of course, there's always the liability aspect, and that's a different topic and a completely different problem.
Right.
But we have been fortunate in that we are able to refer patients out, provide our patients not only the referral, but also prescription medications free of charge. And
I was going to ask you, do you get any samples from the pharmaceutical people? You have anything in your office that you can hand out? Somebody needs antibiotics, or...
Yes, we do. Yes,
you do.
We have, we get a lot of medication samples from drug reps. And we also have pharmaceutical companies donating large boxes of certain medications that we use commonly, like antihypertensives and antibiotics. And those medications that we don't have, we're able to send our patients to a local pharmacy in Newtown, where they get their medications free of charge as well.
That's great.
And some medications, if it's expensive, they can get it at cost from the drug center pharmacy of Newtown. We also work closely with patient assistance programs available, and we're able to get most of our patients most of the medications they need on a continuous basis.
Okay, now I thought I heard a caller. No? I guess our machine is just happy to see me tonight. Okay. Bill, how about yourself?
Well, yeah, I can reiterate. I mean, there's a dilemma for physicians that maybe the audience isn't aware of about the idea of taking pharmaceutical samples.
Yeah.
And it, in fact, national organizations, physician leaders have implored teaching physicians to not have a relationship with the pharmaceutical industry.
Right.
But for me, it's a huge dilemma because I have a host of patients that really could use these samples whenever we can provide them. The other thing I think the audience should know about, maybe they're not aware, there are two large chains, if I'm allowed to name.
Sure.
Well,
tell it like it is. Sure.
Yeah.
No problem.
Well, Target and Walmart have now, they buy in such a large volume that they can offer some of the common generic medications for a very low price of $4 a month or $10 for a 3-month supply.
Target and Walmart.
Target and Walmart, and anyone could go in there and they can get a variety of blood pressure medicine, diabetes medication, antibiotics, many different types of medications for a very low price. And so we are trying to transition our patients over to, if they don't have any insurance, we try to transition them over to at least taking advantage of the Walmart Target process whenever we can.
Well, that's good news to hear. I think our audience should hear that, Bill, because sometimes the pharmaceutical companies, we do give them a beating. Sometimes I do it myself. And so it is nice that they do help with... now, how does that work? It's not is it the pharmaceutical companies or the drugstores themselves that give the discounts, or is it a combination of two?
Well, in his case, he has a special relationship with that drugstore in Newtown.
Newtown, yes. Yeah.
That's great.
Target and Walmart are just drugs, they act as the drugstore.
Great, okay, gotcha.
We do the same. In fact, we use a lot of Walmart and Costco for, Target, excuse me, for that purpose, the generic program. The same program that Bill mentioned, yes, absolutely. Yeah.
Good. Now, Mike, what's the history of Kevin's clinic? That's a pretty special place, right? And near and dear to your heart. Do you want to talk about that? If you don't want to, that's
just maybe briefly. Okay, we started it in memory of my son Kevin, who passed away about 6 years ago in a tragic accident.
Yep.
And at the time, different community leaders wanted to find a venue to maybe do something positive, hoping something positive can come out, and we decided on a free clinic. And I'm very happy that we did this, and that we find not only the support that we need, but also the need itself for this type of clinic, free clinic.
Sure, and Mike, taking that personal initiative, not only are you doing a great service, for the Newtown and the surrounding areas, but you're really making us all look good. You're doing a great thing for for your colleagues. That's just wonderful. That's just great.
It's a team effort, and what makes Kevin's Community Center work is really the support of not just myself, but all the physicians that volunteer their time and expertise and skills to make it happen. And so it is a team effort, and very hopeful that this can maybe expand and maybe hopefully serve as a model for future free clinics in different communities.
That's wonderful. How do we, do people just call you up and say, hey, Dr. Towie, I want to donate $500 to your clinic, or do you solicit? I mean, how does that work?
Most of the times that's how it is.
That's great.
It's mostly unsolicited donations, and not always money. Of course, we get donations, people donating their time, skills, volunteering. At the center, in fact, we have 75 volunteers between clinical and non-clinical volunteers donating their time to make the clinic run the way it's supposed to be. We have board of directors, advisory board, different committees, 7 in total, that will make it happen. In fact, running the clinic and seeing patients is the easy part.
Yeah, right. Huh?
Believe it or not, it's the easy part. But of course, all the work behind the scenes to make it work, and to make sure there are the medications that we need, and the network of referrals and the support system that's needed, which includes not only doctors and nurses, all of whom are volunteers, of course, but also community leaders and community participation, not just Newtown, of course, also surrounding towns. And now more and more people know about Kevin's, and if they feel that this is worthwhile, they decide to either donate money or volunteer.
That's wonderful. Well, I'm going to put in a pitch for you, Mike. Anybody out there who's got a few extra dollars and you're not sure what you want to do with it, contact Mike Towie. He's doing God's work there in Newtown, and whether it's $1 or $1,000, I'm sure you're gonna appreciate it, Mike. But let me ask you now. There in the your building is right on Main Street there, right?
The Seaford and Ford Community Center is at 70 Main Street.
70 Main Street, right?
Across from Walgreens, and past the old course.
Now, again, Bill, how about you for funding? How does that work for you?
Well, it's a hospital-based clinic, and it's a much more regulated environment, and all the employees work for Danbury Hospital. The Danbury Hospital is a part of Danbury Health Systems, and there's a charitable mission, and Danbury Hospital considers it their duty to the community to have charity care. So we come under that charity care. We run a huge deficit because of the economics of life at running one of these clinics, but the hospital accepts that as part of doing business as a good community partner.
See, I'm glad, both of you fellas are talking about this kind of care. Bill, we often hear about, the high cost of health care and hospitalization and this and that. And I don't think many people know what you just said, that how much doctors like Mike himself, who are running a clinic, or you as an executive director, for Danbury Hospital, that this is a service that Danbury does for the community. And Danbury Hospital doesn't really make a profit there. I mean, they're not making money off of this. And,
no, we're losing millions of dollars running this clinic.
See, people don't understand that.
Yeah, it's a huge sum of money every year.
They just now
we have a little bit of a different mission there too, because we have a teaching responsibility, and that's where the young doctors from Danbury Hospital who are in training programs come there to learn how to become primary care doctors. So there's a teaching aspect to our role there.
Great, and I'm glad you. As a matter of fact, Bill ran over here tonight. There was a graduating ceremony for the young doctors at Danbury Hospital, and Bill was, when I called Bill up a few weeks ago, he said, well, I promised the residents I'd be at their graduation ceremony, and he managed to sneak out, so I appreciate that, Billy.
Okay.
Bill, tell us a little bit about that. How does that correlate with the teaching program? Because, sometimes somebody might be in there and they'll see a resident, or, and they're not sure what's that's all about.
Well, if you were to go to your family doctor,
Right.
you see them face to face. In this setting, they see the young doctor. The young doctor then leaves the exam room and comes to present the case to the attending,
Right.
and then goes back and makes the final. So it's a little bit of a lengthier visit.
Just
takes
like
longer.
all three of us were
Yes.
many years. I'm the oldest one here, so my God, that was 35 years ago for me, and that's great. Now, how did you get into this, Bill? You used to be what we call a hospitalist, and we've talked a little bit about that a few weeks ago. Hospitalist, you know, years ago, the family doctor would follow. If you got sick, the family doctor would follow you into the hospital, and until you got discharged. Nowadays, because hospital care has gotten so complex, most of us, I think all of us in primary care in the community, delegate the care of our hospital patients to somebody called a hospitalist who is there all the time, rather than the family doctor just being there for a 10 or 15-minute visit in the morning. Bill, so tell us how you went. Tell us a little bit about your hospitalist experience and what you're doing now.
Well, I started at Danbury Hospital in primary care, and I was at primary care of Danbury over at Sandpit, and saw a glaring need for a more organized way of managing the inpatients, because we were so busy in the hospital and the nursing homes. As you know, we're running around between all the nursing homes and the hospital. And the chief of medicine asked me to come over and start that program.
Yes, excuse me. 4 minutes to break. 4 minutes. Okay, thank you.
So at that point, I came over and set up and ran the hospitalist team and got it up and running. And I just had a yearning to get back to primary care, and was asked to go help out at the clinic one day when they were short of a doctor, and found out what it was all about, and just felt that it was a good calling for me to go there to do what I like to do, which is the teaching aspect, and to take care of the people who were very appreciative of the care that we can give them.
You know, it's amazing, Bill and Mike. See, you know, I've spoken to doctors who take care of the uninsured and the indigent. Some people go to these poor countries for a 6-week tour. They take medical students with them. They always say it's one of the most enriching experiences that they had. And maybe that's something that some of us, with all the complexity of insurance nowadays, you guys probably are closer to the real medicine than many of us who are delivering medicine for the insured patients. You probably get a lot of satisfaction that we sometimes miss. You know,
do you want to comment?
You want to comment on that, Mike?
Absolutely, yes. I actually do. Yes, I do both, and it's amazing the difference. You know, I'm in my office, my private setting, and on Wednesday morning, and then 5 hours later, I go to Kevin's, and it's a completely different setup. It's a completely different experience, and it is truly what pure medicine is. No prior authorizations, no pre-certifications, no excessive paperwork and documentation that really takes too much time and takes away from the patient-doctor relationship and time spent with the patient. Completely different, and of course the patients are very appreciative and thankful for what we do, and it's very rewarding in many aspects. And it's just completely different experience from what you would experience. Not very different from, you know, like you mentioned, if you were to go overseas and practice medicine in an environment like that, the type of exposure and the type of medicine, aspect of medicine, that's really very pure, very satisfying.
Good word, yeah. Mike and Bill, too. How about the liability aspect now? Because I'm sure people are wondering about that. Of course, you have your own liability insurance, Mike, and Bill, you probably have with the hospital. Yeah, okay, so that's
it's pretty routine.
What you do.
Try not to think about that.
One problem for us, because the setup is different.
Right.
We're a 501c3. We don't have hospital insurance, and a physician likes to volunteer at the center. They still have to have their own liability insurance, unfortunately. And of course, some physicians might worry that this might increase their liability insurance or change the terms. Of course, most of the times it does not, but they're still required to have their own liability insurance. And it was suggested, still is, that maybe we should approach the political scene in Hartford to see if we can make a change in that aspect, especially for physicians who are looking to retire but still want to volunteer, donate their time and skills. And where this can be achieved, and keeping the cost down of running a free clinic and motivating, you know, physicians that they don't have to invest so much money every year just so they can volunteer. Of course.
Right. You know, Mike, just let me interrupt you. I was this last week. I spent the entire week in Chicago at the AMA annual meeting, and one of the top issues was providing care for 47. I guess the number now is around 47 million uninsured in this country.
Sure.
And most physicians were really upset that richest country in the world, how can this go on?
Can I just say,
of course you can.
What would be your guess as to which county in Connecticut would have the highest number of uninsured, the highest rate of uninsurance?
I would say, Bill, either Bridgeport or New Haven.
No, when I was preparing a talk this year, it was Fairfield County, the highest number of uninsured.
You're kidding.
And it's it tends to be the young people who are not, they're starting out their careers, they're foregoing insurance as they're trying to get their feet off the ground out of college and everything.
Fascinating.
But in this area, there's a lot of uninsurance.
Fairfield County.
Fairfield County.
The richest county in Connecticut, right? Basically.
Basically.
Yeah. Right.
Yeah.
I thought you were going to leave. I wasn't going to say Fairfield County. I said that's got to be a loaded question, and that's being written about a lot. The kids are graduating college. All right, I see that we got just 30 more seconds. Kids are graduating college, and they don't have insurance, and they can't afford it because they don't have a job yet. Okay, so that's it. I wish we had more time. Two great guests, Bill Delaney, Mike Towie. I think next time we have them on, I'm going to have you bring a couple of your patients and let them give us a little rundown on their experience with you guys. And hopefully we'll get some donors to help Mike with his Kevin's Clinic. All right, thank you, and hope to see you in the fall. I hope to have my own show, and we'll just keep on going. So, Bill, good to see you.
Very much, Ed.
Mike, thanks. You guys are both busy, and thanks for taking the time out to share your views with the public.
Thank you.
Thank you.